Okay, good morning, everyone. Thank you for joining Celebrate Life Cancer Ministry in our monthly support group meeting. We are joined today by Von Carnelis and Jurline Redeaux, and they're going to be talking about blood cancers as well as endometrial cancer, which is the cancer, some of the cancers of the month. There are a number of cancers, including prostate cancer, that is also in this month. Um, but because we all always hear about October and breast cancer awareness, but we also want us to begin to take time to recognize some of the other cancers as well. So we are Facebook Live for those that are on Zoom. But in either case, feel free to make comments in the chat box. After each presenter, we will have some time for question and answer. And then we'll be able to read your comments from Facebook as well as the ones from Zoom in the event that you don't want to speak out loud. Okay, thank you so much. We're going to start this morning off with my sister, Vaughn, our line dance instructor and great supporter of Celebrate Life. We welcome you now. Good morning, Vaughn.
Good morning, everyone. Thank you, Pastor Rhonda, for the opportunity to share my testimony and also to share some information regarding blood cancer. September is Blood Cancer Awareness Month. So I would just like to bring to the forefront some of those blood cancers that perhaps some people have never even heard of. I am an 11-year Non-Hodgkins lymphoma survivor, which is a type of blood cancer. And until I was diagnosed in 2008, I didn't know, I knew about leukemia, but that was about it. Okay, so some of the blood cancers that we are trying to get out there, get a little more information, is multiple myeloma that falls under that category. And that's a cancer that forms in the bone marrow. Okay, we also have leukemia, which is a white blood cancer. That's where most of the damage or whatever is in the white blood cells. Also lymphoma. Okay, there's two different types of lymphoma. There's a lymphoma and a non-Hodgkin's lymphoma. And I was diagnosed in April of 2008 with stage 2 follicular. Lymphoma has quite a few different forms. As a matter of fact, there's over 70 types of lymphoma. So you have to have extensive testing in order to find out exactly what kind you have, and then proceed on with your treatment plan. We also have in the blood cancer category is something called MDS, and I have to look at my notes because it's a big old word. It's myelodysplastic syndrome. That's what it stands for, but you'll most likely just hear it as MDS, which is usually comes prior to a diagnosis of leukemia. Okay, so like I said, my diagnosis was non-Hodgkin's lymphoma. I did not have any symptoms. I did not have any symptoms. It was purely found through an excellent doctor. My regular doctor is very, he's a perfectionist, but not to a fault, because had it not been for him continuously watching my lab work, my blood work, and I guess he noticed, some numbers were kind of elevating. So he started checking me every 3 months. So after the second time, he asked me to take a ultrasound, and was asking, oh, are you having any stomach problems? No, I've always had back issues, but I had no stomach issues, nothing after eating, whatever. And so he did the ultrasound. And then later he called to ask me to do a CT scan. That's when I got scared because I knew something was going on. So it just took me very much by surprise when he called to say, it looks like you have some type of lymphoma. But there's several kinds, so we need to find out, what kind. We did a lot of testing, and it took about 3 weeks before I was able to start treatment, because I also had to endure a bone marrow biopsy to make sure it wasn't in the bone marrow, because that would require some other type of added treatment or whatever. But however, it was stage 2. It's called follicular lymphoma, which is a slow growing cancer in the blood cells. And thank God it was only a stage 2, because like I said, I did not have any symptoms. Some of the symptoms I did note, I wanted to share, but I didn't have them, was painless swelling of the lymph nodes. And that's typically in your neck, your armpits, and the groin. Now, a lot of times, if you just have a bad cold or bronchitis, whatever, your glands will swell. So it's easy to miss it unless you have a cold or some type of illness, requiring doctor's care. But yeah, so it's painless. So after we had been going through a lot of the different tests or whatever, then I noticed, before I started my treatment, I did notice, I happened to be washing dishes one day, and my groin area touched the front of the sink, and it didn't hurt or anything, but and that's when I said, oh my God, it was swollen, but it wasn't hurting. So I hadn't even noticed it. And that's when I noticed that I had a swelling in that area, but it was painless. And that's the area where they ended up doing the CT scan to get further testing or whatever. But another symptom was fever, and that's easy to bypass because fever is fever, or you take a couple of aspirin or whatever and it goes away or whatever. But fever, unexplained weight loss, sweating at night, not just what's that thing they always talk about, the ladies going through the change, night sweats or whatever. It's not like that. It's something different. And then also a lack of energy, and also excessive itching, where your skin itches a lot. These are some of the symptoms that I found, but I did not experience any of those things other than that little swelling that I found in my groin area, and it did not hurt. It was not causing me any problem. So just to let you know some of those symptoms, because this type of cancer is easy to ignore, because it's subtle things that you might experience, and because it's not really hurting, you had nothing to complain about. So I was just carrying on, and that like I say, my doctor is the one who I give credit to, and the good Lord, of course, for being persistent and continuing, because some doctors could have bypassed it, they could have missed it. But the type of doctor he is, very professional, very thorough. And so, needless to say, we got a connection with an oncologist, and then I started my chemo treatment. And that was for, I had 24 rounds of chemo, which over a period of 6 months. And the first 3 days, I cried a lot, I prayed a lot. I just was trying to understand, oh my God, how, out the clear blue. But after about 3 days, I got myself together, and, I just said, okay, devil, we just gonna have a battle. So I put my boxing gloves on. And ever since, my attitude is big. You got to have a good attitude going into a cancer battle. And I mean, I was so positive. My dearly beloved sister Betty, God rest her soul, because she later passed with leukemia. But she came to me and asked me, Vaughn, are you sure you have cancer? Because I was so positive and trying to just do what I had to do. I was doing my part or whatever. So I definitely had a positive attitude. And I also, oh, I left my little 2 buttons. I brought them with me, but every time I went to chemo for 24 rounds, I had bought these little, this was helping me to get my little attitude or whatever together, but these 2 buttons, and I still have them over 11 years ago. One of them says, Jesus heals. And I would wear this to chemo every time I went. And also, in God I trust. And I still have them. They're sitting on my bulletin board above my headboard. Just a physical reminder of how good God is. And yes, I did trust him, and he got me through it. Now, one thing I would like to also say, because it wasn't easy peasy. I mean, I felt good. I went on, I was getting my checkups or whatever, but around 2014, it surfaced again. And a lot of people may not even know that. I just, but it was such a small amount. They chose, instead of treating it at that time with chemo, they suggested watchful waiting. Another term I'd never heard of. I'm like, excuse me, I have cancer and you want me to watch and wait? I couldn't get ready for that. But of course, my doctor, my oncologist, explained to me that a lot of times like I said, I had a slow growing lymphoma. It's follicular, it's indolent, it's slow growing. And many times they choose not to do anything and just watch and wait. So for every 3 months, I would go in, do my lab work. And after about maybe seven times I had gone in, it just disappeared. Wasn't there anymore. So I never had a second round or anything. I didn't have any treatment. And so far, God has been faithful and I'm doing great. And one thing I would like to add, sometimes when we go through difficulties or illness or whatever, it really opens up your eyes when you're in a cancer battle and you start thinking about life and, So one thing, and those who know me very well know that I love dancing, and had it not been for the cancer diagnosis and battle, I would not have gone, finally realized, girl, you keep on talking about you want to teach line dancing, and y'all, those who know me know I'm an avid line dancer. And I kept saying I wanted to teach, but after the cancer battle, I did start a class in December of 2009, and I've been teaching throughout the city at different churches, senior centers. I think I've earned a name for myself. And it's just been a wonderful thing that I said, well, Lord, I had to get cancer to finally realize my passion. But I do believe that's what it was. And by me teaching a lot of places, that was helping me to get even more exercise. I think that's what's keeping me going. And because I'm constantly, teaching somebody, I love having students in front of me. And so I know that it also helped with me to keep my health together, because I was not just attending a class, I was actually teaching, and I had students from, various places in the LA area, traveling and whatever. I was just really, ask my husband, he'll tell you how much I was around the city teaching or whatever. So like I say, a lot of times we go through problems and physical issues, and there's a reason, and God has been in it from, I'm a firm believer of the power of the Lord. He's been in my life for a very long time. And like I say, attitude is everything when you're dealing with a cancer battle. And so that's here I am. So again, I would like to give props to our fearless leader, Pastor Rhonda. When I was diagnosed, I believe in support groups or whatever. I'm not afraid to do therapy or whatever. So I called the American Cancer Society in the beginning when I first got diagnosed, because I wanted to get involved with the cancer ministry. And they gave me a couple of, you know, groups, and Celebrate Life was one of them. And I'm gonna be honest, I didn't know Pastor Rhonda. I didn't know nothing about Celebrate Life Cancer Ministry. So I chose it because I don't drive the freeway. I don't drive the freeway, and it was close enough for me to get to the meetings. That's how I made my decision. But it's a decision that I definitely do not regret. From day one, when I spoke with Pastor Rhonda over the phone, I just sensed a warm, I mean, it was just amazing, the experience of, you know, my first time talking with her. And as they say, the rest is history. I've been involved with Celebrate Life since my diagnosis, and I'm doing fine, but I'm still very, very much involved. And I'm very happy that the Lord led me to Celebrate Life and Pastor Rhonda. Okay, I just want to thank you again for the opportunity. And that's my story.
Amen. 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 Um, Thank you, Vaughn. You know, I'm behind here doing all these technical things. Sorry for the feedback for just a moment. Um, but now we're going to move into. Were there any questions for Vaughn before we go forward? All right. So now our next presenter is Jurline Redeaux, and she is an endometrial cancer survivor who we actually met before we knew we met. We actually spoke on the same platform a couple of years ago. And you know how it's during a church service, so we don't, you know, you didn't get a chance to say hello or meet anybody. But then a couple of years, last year, we ran into each other doing the work. And just haven't let go since then. So I present to you now Miss Jurline Redeaux.
Well, good morning, everybody. And once again, thank you, Pastor Rhonda. I can't say enough. I piggyback on Yvonne. Pastor Rhonda was able to let me get my message out. And we share a lot of the same story, so to speak, because I was diagnosed with endometrial cancer in 2017. Before 2017, I had never heard of endometrial cancer. Can everybody hear me okay? Okay. I had never heard of endometrial cancer. Since that time, I have found out, that's why I'm so thankful that we can celebrate Uterine Awareness Month, because I'm sure most of you have heard of cervical cancer, ovarian cancer, but never ever heard. And I've been in the business of, I have a small nonprofit, New Impression. We've been doing healthcare disparities, talks about diabetes, everything. I've been in the breast cancer community for years. I've lost several dear friends, but never heard of endometrial. And I just want to share some facts about it, and you'll find it shocking. About 1 in 39 women will be diagnosed with a uterine cancer at some point in that life. This makes EC, endometrial cancer, more common than cervical or ovarian. If caught early, survival is coming. But this is what I want to take away. I want everybody to always have a takeaway. Black women are more likely to be diagnosed at a later stage and to have an aggressive disease. One thing that I know is early detection saved my life. Once again, I piggyback on Yvonne. There was no pain. There was no cramping. But what I want to emphasize, abnormal bleeding, any kind of an abnormal bleeding, especially after menopause, don't pass go. Immediately schedule appointment with your general practitioner, who should then send you to a gynecologist. So what happens after we get postmenopausal, we don't see the gynecologist anymore. It's almost like, oh, well, they don't have to do nothing no more. So that's the one thing that I emphasize, that abnormal bleeding. In my case, I only saw one drop of blood. And I know this so well, it was coming up to Christmas and it was on a Wednesday. Okay, I thought, is it really a drop or what is this? Thursday, I went to work and I went to the ladies' room and there was a smear of blood. I immediately went to my car and I called my doctor's office. I said, I need to see somebody tomorrow. Second thing you're gonna hear my takeaway, self-advocacy. They said, well, Dr. G won't be back until after Christmas. So you go, I said, I don't care who's in office. Whoever's in the office, I need to see him and I need to see him tomorrow. Friday morning, I was in my doctor's office. The reason I suspected I had endometrial cancer is because I Googled it. I know they say you ain't supposed to Google stuff, but I had never heard of it, right? So what else was I supposed to do? So the person that I am, I always advise my doctors. Let me tell you, that's why I'm gonna talk about ECANA, the group, afterwards. But when you are educated about anything, it commands your doctor's attention. See, when you walk in that door, and this is a brochure, if I was talking to you guys in person, it's from ECANA, which stands for Endometrial Cancer Action Network. I'm an ambassador. Adrian is on the call with us. We're ambassadors. It was started by a Black doctor, Dr. Kimmy Dahl, who is a gynecologist, a surgeon, researcher. She was seeing too many Black women walking in her clinic, in her door, that were at an aggressive stage. And she said, nobody's talking about endometrial. And this is why I thank Pastor Rhonda. She has given me every chance to talk about it. Anytime I can talk about it, I'll come to your church, I'll come to your backyard barbecue. If you want me to talk about endometrial cancer and why we Black women need to be aware that it's killing us. And while I'm here is because I went right away. When I walked into the door, when I finally got to see the gynecologist, because when I saw, this is another point, when I saw my general practitioner, she was a nurse's practitioner, she said, let me give you a pap smear. Ladies, a pap smear won't tell you if you got endometrial cancer or not. So I was like, whatever, because I'm thinking to myself, what is that? You know, what's causing this bleeding? I'm not supposed to see any blood. And I don't want you guys to ever minimize bleeding, whether you're post, pre, young, old. If it's abnormal, see your doctor. It doesn't mean cancer, but just like Yvonne shared earlier, it puts your doctor on notice. Watch and wait. I love that. Watch and wait. Because if you don't put them on notice, they're just going to treat you like you're supposed to bleed. What's your problem? Every 30 days, you bleed. Why are you in here? No, if you've been bleeding for 30 days and you got to put on a pamper and a pen and you scared to go out the house because you're afraid you're going to ruin the couch, everything, that is not normal. So what she did was finally referred me in January 2017. I finally got to see a gynecologist. Look at December, January. Do you guys see how quickly that window was for me? If I would have waited into March, I wouldn't be here. When I got there, he did a biopsy. I didn't know what that was. Once again, they don't tell you anything. They just usher you in them little rooms and lay you on them tables. And you'll be thinking, now what's going to happen to me? All he said is you might pass out. And I'm like, oh, you mean you ain't going to put me to sleep? He was like, no, because you just might pass out. Most people do. Well, you guys, I have a high pain threshold. I almost did more than pass out. I almost kicked him. It's very, very painful. Believe it or not, that's the only pain I experienced in this whole cancer journey. Not even when I got my port installed, because it's so many layers. I love the way Yvonne explained it. Once you get that diagnosis, your life changes immediately. It's not like, oh, wow. It changes immediately, because the last thing you want to hear at 7 a.m. in the morning is a call from your doctor. You already know you got cancer. Nobody calls you at 7 in the morning. That once I got that diagnosis, this is so important, ladies. He looked me in my face and he says, Jurline, I'm going to send you to the best gynecologist. Yes, attitude is everything. When he delivered my daughter's babies, as it turned out, and I always had a positive, even when he hurt me so bad, I was like, look, I'm gonna hurt you, because I always bring humor into it. Attitude is everything. And he did. He sent me to the best gynecologist in the Long Beach area. I went to Miller's Cancer Pavilion, and it was like the Beverly Hills of cancer. If you got to get it, that's where you want to go, because they treated me like I was a human being. And ladies, I want to also say this. You are the team. If you have a doctor who is not considering you as the center of the team, it's time to change. The team is whoever you want to make a part of your team, your daughter, your best friend. You need a team, because sometimes you don't even hear what they say. Like, I didn't know I was stage 3. I'm sure he told me, but that just went over my head. I just wanted to know what was the next step. So this is so important in terms of picking your clinician, your oncologist, your general practitioner. If you're not happy, if they're not listening, please change providers. COVID-19 is making it quite complex, but I don't care. If you're having any abnormal bleeding or any symptomology, such as what Yvonne shared, you have every right to demand to be seen. Don't tell them, no, I don't want to see you on the video. You need to look at something. How you going to check my bleeding on the video? You got to advocate. You're going to hear me say that through all this testimonial learning, because I've always been an advocate, but I really became one when I found out nobody knows about endometrial cancer. I went to presentations and I say, how many people ever heard of endometrial cancer? I've only got one hand, and I've done a lot of presentations. They have no clue. They get it confused with endometriosis. They ain't the same animal. Endometrial cancer affects the lining of the uterus. That's where it's at. And I'm going to jump to treatment, because the only treatment for it is a hysterectomy. That's the one thing, because they got to get it out. If it's in there, it's not like any other cancers. And in my case, I was very, very fortunate, because I went early. He could take the uterus out through the vagina. It's called a robotic procedure. So early detection is the key. Knowing the treatment options, just like Yvonne shared, that's the key. You might, if it's more advanced, they might not be able to do the robotic. But one thing you will know when you walk in the door is say, doctor, what is the least invasive treatment I can have and still save my life? because then they know you know some terminology. Knowing the terminology will change their view because they know you're somebody who's educated on the subject of your body. This is your body, and nobody knows it better than you. You know what aches, you know what works. So one of the things that I always emphasize is to make sure that you are getting all of the information about what's going to happen. A big shock was chemotherapy because like Yvonne, I didn't have no pain. I was back home on Friday. You know, they took out the hysterectomy. I was ready to go to Vegas. I was like, ha, woo, this is a piece of cake. This endometrial cancer, I got this. So like Yvonne, I went in for my little checkup and cute, aren't those doctors cute when they deliver you these messages? Cute little resident. Oh, by the way, and we're going to start trying a round of chemo. I looked at that lady like, what you say? I almost fell off that little table you sit on. Y'all ain't said nothing about no chemotherapy. And then, you know, once again, this is a whole new animal because you're like, chemo, oh my God, what? But once again, just like you, Yvonne, I just had such a positive attitude. The most hardest thing I had to do in this whole journey was to come home and tell my daughter. It's only 2 of us in California. Most of my family live in Chicago. But I remember when I comfort my baby, I said, Lavanya, God knew if anybody could come through this and live to tell other people, it's me. I'm not going to die. That I'm not going to do. This is a mission. And she looked at me and immediately she knows because she's watched my walk, as Yvonne said. Sometimes all I had was my faith. I didn't have nothing else but that. So why change now? So my faith was the cornerstone of how I got through it. The second thing was my attitude. You're absolutely right, Yvonne. I was such a celebrity because I ordered all these moo-moos. And every time I would go for a procedure, I had to have a port installed. And if you guys don't know, a port is inserted in your chest. So because they're going to put the chemo through there. And also they do blood work like Yvonne, you know, she knows, we know blood work. You'd be like, okay, whatever. But when you got the port, they can do that. So every time I had to go to the hospital, ladies, I was looking like $1 million. I had on my tutus and some lipstick and eyelashes and stuff. They was like, we never know how you're going to look. It makes them feel good too, because they have to do things to you that's going to be painful. But when you have a good attitude, then they are also feeling more comfortable. Consequently, you're going to not feel as much pain. So once again, I have to piggyback. You told my story. Each chemo, I had 6 rounds. Every 3 weeks, I had another round of chemo. That gave me time to recover. So once again, that let me know with that early detection, getting in there so early, they were able to spread that chemo out, which would give my body time to heal. But each chemotherapy, I had on a different tutu, a different moo-moo, orange, any color. They never knew. One day I might have some blonde hair. See, they didn't know I was bald all the time because I have alopecia. So don't worry about your hair, y'all. I ain't had none to start with. So that was one thing I didn't have to worry about. So I used to have blonde hair. Some days I'd have on a little this kind of wig, but that helped me. And another thing, I could even work doing chemotherapy because they have free Wi-Fi. And I was a remote worker. Child, I said, this is better than sliced bread. Since I got to be here for 8 hours, I might as well get paid. Yeah, Pat, I worked while I was getting chemo. But you know what? All of this helps your recovery. You can have the dire diagnosis But if you can keep focused on the positive part of that, that will get you through it. I am going to talk about side effects because I still suffer them. One of the side effects from having chemo, I was diagnosed in 2017. It's 2020, sounds like it was a long time ago, but now I'm cancer free, but I still see my oncologist every 6 months until the 5-year, which is good really, because now with COVID-19, you can't see no doctors. So you got to look at the positive out of this, right? So I see my doctor every 6 months. And I love that watch and wait, because that's really what they're doing with me right now. They're watching and they're waiting, and they want to make sure that I'm recovering. And if it comes back, they're going to be able to get right on it. So don't let the negative or, oh, I got to go see my oncologist. Think of that as a checkup, a wait and what I'm going to use that all the time, a wait and see, because it's an opportunity for them to see how you are doing. Second side effect, I was already fat when I started this process. I ain't been able to lose not a pound, but I'm doing my exercise just like Yvonne. I found out that the exercise helped me, because something else I want to talk about is your mental health. Do not leave out mental health. Your mental, ain't nobody gonna be sane with a chronic diagnosis. I love God, he took me a long way. But somebody tell you might die, it's gonna mess with your head some kind of way. It's okay. I was already on depression medication before I got my diagnosis. So what did I do? I bought my team in. I said, you guys, I'm already depressed. So y'all gonna have to manage this. Don't be ashamed to share whatever it is, because they can treat it. You're in the best of hands. You're with the people who have saved lives, white people. They got the best treatment. When you get with your oncologist and their team, they got you. I never did hardly ever go back to my general practitioner. I had a nurse practice I could call up at any time. So this is something else. It's a mental health challenges, and Yvonne was smart. She started a support group. God blessed me with Adrian, who brought me into Ikana, a whole group of women, all which had endometrial cancer. We were trained in Hawaii. We came back fired up to share, look, we are surviving this. And whenever I talk, I want to remind people, we are survivors. You know, we've been through it. But think of the survivors that don't get as much play. You hear a lot of the, oh my God, they didn't had it for so many years. Woo, wow, oh, woe is me. Don't even listen to them. You know, the people that tell you about some of the alternative medicines, please shut them down. And the ones that tell you they didn't drink X, Y, and Z, don't listen to them. You're going to get more advice from more people that don't know nothing than you ever heard in your life. Blank them out. Because this journey, and I love the way Vaughn said it, this journey is a journey that's going to take you to a new form of life. And I say this, and I'm not trying to minimize the seriousness of it, but cancer saved my life. It gave me purpose. It made me want to appreciate the smallest of things, the butterflies, the flowers, whatever. It gave me more purpose. And it doesn't happen all the time, but we're wanting to encourage you to do the things that we've done. Join a support group. Find your passion. If it's line dancing, now mine is back to hiking and body conditioning, because I do feel like I can control my weight a lot better than not doing nothing at all. So that's the one thing. The one takeaway is that it's treatable, early detection, and all bleeding, all abnormal bleeding should be seen by a doctor. And once again, I just thank Pastor Rhonda. I'm happy that Adrian, my ambassador sister, is on here because we want to save lives. And the only way we can do it is through education. And as I close, I say to anybody that's on live, anybody that's on the Zoom in the Southern California area, I am available to do as many educational talks. If anybody would like a brochure, which has our website, and you want to learn more about it to share with others, you can inbox Pastor Rhonda, and I'll make sure she get a stack of them. If you're in the Atlanta area, we have my sister Adrian Moore, who, like she said, we get called on. I didn't even know I was on a program, but we have a website that I would love for each and every one of you guys to really look at the website, because we're about saving lives. And once again, thank all of you guys. Facebook Live, thank you. Pastor Rhonda, I can't thank you enough. Yes. Oh, thank you. Look in the, we got the website in the chat. Thanks, Adrian. Okay. Okay, Pastor Rhonda. Pastor Rhonda.
All right, good morning. I'm back. Okay, I did hear you the first time. You couldn't thank me enough. Thank you.
I can't.
Okay. Thank you so much. That, you know, and I think the part that can you hear me? Okay, so I think the part that really. All right. Good morning. Okay. Uh-oh. Okay, I did hear you the first time. You couldn't thank me. Uh-oh. Now can you hear me? Can you hear me still? Awesome. Okay, so and I think the piece that really gets me is the spotting after the fact, because I think that was one thing that I heard last year, that, you know, even if it's just a drop, and it's a time when there shouldn't even be a drop, you need to go check that out. And it might stop, and, you know, and the biggest thing for us is, you know, something occurs and then we forget and we don't write it down. And I recommend that we have a list, that you just, a running list that you keep making, so that when you get to the doctor, you can like, oh yeah, I forgot about this. Can I address this while we're here? So that the doctors can get a whole picture on all the things that are going on with us. So thank you again, Vaughn. Thank you, Jurline. This has been an exciting morning, and I don't see any questions, but does anyone have any that they want to ask either one of the presenters?
I have a question. Patricia.
Okay, I don't see any questions. Oh, is that Pat? You want to say something?
I have a question. So I was curious about after you had the hysterectomy, Jurline, did they tell you why did you need to have the round of
all over here?
Oh, the reason why I had to have the chemotherapy, Pat?
Right.
Because it turns out that I'm sorry, that's a good question. Because once you have the hysterectomy, they look at it under the microscope. They send everything to the pathologist, and that person determined that there was something in my lymph node, or it was something that showed up. And that's the reason why I was stage 3, because it was once again like a drop of blood, but it was, see how, even though it was a drop of blood as the sign for me, but it was growing in this in the endometrial, in the lining. So once they looked at it, once the pathologist looked at it, they knew that they needed to go ahead and give me 6 rounds of chemo.
Okay, so that it was outside of the lining as well. So it was in a lymph node, is what you're saying?
Well, no, it was in the lining, but when they looked at the lining, and you know how they talk to you, but whatever they saw, whatever, it's almost like looking at the biopsy and they said, oh, there were some cancerous cells That's about the best way I can explain it, that it wasn't outside of my uterus. They had took it out, remember? They took out the uterus,
Right.
and then they examined all the tissue. You know, it's tissue attached and all kinds of stuff attached to it. And that's when they discovered that I had a proclivity to get the cancer if they don't treat it. Something caused them to notice that I needed 6 rounds of chemo.
This is Willie. I can when it's in the lymph nodes, they have to treat it as though that's what carries the cancer to the rest of your body. So once they see it in your lymph nodes, even if they don't see it yet in the rest of your body, they have to act as though it had already started to carry. So they wanted to just make sure that they killed any traveling cells just in case. So
exactly.
Yes.
And another thing that I didn't mention is they do a test called a CA-125. That test also, thank you very much, Willie. That test also lets them know where the cancer is at. So it's amazing how it's all connected, because they can see your blood, the numbers in your blood should be like, now they'll say, oh, Jurline is like 4 or 5. And honestly, you guys, these are good questions. I didn't even know to ask these questions because I didn't know anybody that had endometrial. So thank you, Pat and Willie. Thank you for explaining, because you don't know.
Mm-hmm. Thank you. It's really very good to hear both you and Yvonne as I begin my journey. So I appreciate especially the things about a good attitude. And, you know, I've already learned things that I didn't know before, and in a good way. And all the support of people, you know, it's really brilliant to see how, like you guys, I mean, being willing to help other people. Anyway, thank you very much.
Thank you. Thank you, Pat. Thank you so much.
All right, so I just want to share my screen for just a moment, just so that we can look at, can you see my screen?
Oh, yes, thank you.
So there is the Econo website, and under education, you will find a plethora of resources.
Yes.
So feel free to go there and join in. And then I want to show you a couple of events that Celebrate Life Cancer Ministry has coming up. One is our parade, a pink procession and celebration. And it's, you know, who likes that word drive-by? Nobody. But we want to be socially distanced, observing that. So we want you to get in your car, decorate your car. There's even, you know, some paint maybe that they could put on the windows. I think Walmart or somebody like that carries it. Make a poster, get a picture of a loved one. And it doesn't matter what type of cancer, we're just asking you to wear pink. And then the other little calendar, we're actually going to have at least one car club who will be joining us, and they actually meet over at Farmer Boys and Gardena. So as you see on this other little map, they're going to start from Farmer Boys and on Redondo Beach Boulevard, go over to Vermont, come up to 135th, come up Crenshaw to 108th. And that's actually in Inglewood, and the parade will actually be on my street, and that's over near Wilkie and 109th. And so they will come down the street, and that's where we will have a lot of honking. Hopefully my neighbors will come out and be part of the audience and the crowd, because again, socially distanced. So most of you, and you'll just drive by, make a lot of noise, and it's an opportunity to donate to the work of Celebrate Life. And then we're also having a Think Pink tea, a virtual tea party in collaboration with Sisters, Breast Cancer Survivors Network, on Sunday, October 25th at 4 o'clock. So both of these are actually on Facebook. And so I welcome you to join in with that and join us, come out for the tea party, get your gloves, get your vaccinator, set up your little tea, even if that means the metal tea pot from the stove that blows a whistle. Whatever it is that you have, we invite you to join us, and that costs absolutely nothing. We just ask that you register so we know how many people we're waiting for to chime in and participate. There's a lot of events coming up in October in recognition of breast cancer awareness. I will keep you posted. Susan G. Komen is doing a month-long cancer conference. A lot of the information is focused around metastatic cancer, but yet there are a lot of different things that whether you're metastatic or you've just been diagnosed or you're a caregiver, a supporter, a loved one, there's a lot of information that will be shared that will be a blessing to you no matter where you stand in the journey. So those are all the announcements that I actually have. Is there anyone else that has another question in general before we leave the Facebook Live? Okay, so I guess that's no one. So we're going to end Facebook, but everyone on Zoom, hang on right where you are. Facebook, again, thank you so much. And we'll see you here again on on October 3rd, where we meet again for Breast Cancer Awareness Month for our regular cancer support group meeting.